Ahoy and good morning, everyone. My name is Josh Bovard and I am a clinical exercise physiologist here at Koopman Healthcare Center in Vancouver. For those of you who are joining us for the first time, welcome. For those who have tuned in with us before, welcome back. Unfortunately, my original guest wasn't able to make it today. We're hoping to reschedule her for the next couple weeks. But instead, I'm really ecstatic to once again be joined by one of our physiotherapists, Kosta Ikonomou, who is a physiotherapist here in Vancouver.
Hello, thanks for having me. Glad to be back.
You couldn't get enough of us last week, I bet.
That's good.
So for those of you who have been tuning into Koopman TV, yesterday Kosta posted a video for our Physio Thursday segment. He showed us some exercises that you can do to better your balance. So thankfully, he agreed to join us again today, and we're going to dive a little bit more into that balance and what makes up your balance and how it changes with time. And Kosta is really going to fill us in and give us more details. So I think that's a valuable lesson and some valuable things that you guys can learn and really apply in your daily lives. So best of all, he is going to join us for a walk on the spot and a walk and talk. Now, I was going to, my notes say to start walking, but it ends up we just started walking right from the start. So if you haven't started walking, start walking with us, and we're going to go from there. So like Tuesday, we're going to do an interval workout. So today, we're going to do 2-minute intervals. So on Tuesday, we did 1-minute intervals. Today, they're going to be 2 minutes. With that, we're going to do 3 minutes of recovery between each interval. Tuesday, we did 2 minutes. Today, it's going to be 3 minutes. So we're going to do 5 repeats of 2-minute intervals and 3 minutes of recovery. And like on Tuesday, during the recovery periods, Kosta is going to talk to us about the balance system. Now, a few tips and reminders before we get started. So we would really appreciate you joining us to conduct some exercise in the comfort of your own home while practicing physical distancing. So keeping yourself at home is not only keeping you safe, but keeping everyone around you safe too. So I can't express enough gratitude for everyone's commitment. Now, as always, safety is our first and foremost priority. So if you have any issues with the waiver or the physical activity questionnaire, or have had any recent changes to your physical or medical status, please don't hesitate to contact us. By joining us with this exercise today, we assume that you're physically and medically fit to participate. And so we really want to keep your activity both enjoyable and safe. Second, just a reminder that you can be walking on the spot like we are. We might do a little bit of running on the spot during the intervals today. Or even you can join us while you're on your treadmill, stationary bike, elliptical, or any other piece of equipment you happen to have access to. Just follow along and keep the intensity at a light to moderate pace until I tell you to go easier or harder. Now, for those walking on the spot, a few reminders. Wear comfy shoes, as Kosta told us last week. Consider walking on a soft surface, so I walk on a couple towels. This can be easier on the joint, but be mindful that it might make balancing a little bit more difficult, and we're going to learn about why today. So consider doing it whether you're close to a wall or you've got a chair in front of you. Now, I've also stressed posture throughout. You've heard me say these things over and over again, but good technique is really essential to not getting injured and also maximizing the benefit of this activity. So you're going to have your head nice and tall, shoulders back, keep your chest nice and high, engage those core muscles using my two favorite cues, bracing for the punch, holding the P. And once you've got those, I want you to engage the arms, so you're incorporating arm motion. So opposite arm, opposite leg, to really nail in that technique. Now lastly, find the balance between bringing up the knees nice and high and stepping nice and fast. I said it on Tuesday, you can even try both, just for a little bit of variety, especially when we're doing the intervals. But find what's comfortable for you between raising the knees up high and keeping the steps nice and fast. So we're about 4.5 minutes into our warm-up. We're going to do it for a few more minutes, and then we'll start some higher intensity intervals. So as I mentioned earlier, today we're going to do 2-minute intervals. During the intervals, I want you to step a little faster or bring the knees up a little bit higher. You should really feel the difficulty of the exercise increase during that time. You might notice that saying a sentence is going to become a little bit more difficult because it's going to be interrupted by your breathing. That's okay. It's just a sign you're going a little bit harder. And as mentioned, so we're going to do that for 2 minutes, and then we're going to do 3 minutes of recovery. So we're going to bring it back down to that easy pace for 3 minutes. We're going to repeat that 4 more times for a total of 5 intervals, and then we're going to cool down for 5 to 10 minutes as Kosta kind of summarizes the things that he's taught us. Now, at all times, listen to your body. If at any point the activity starts to be uncomfortable or feel unsafe, stop, contact us. If you're concerned about your balance, don't hesitate to use that chair, use that wall, put that hand on the wall for support. Even this might become more relevant during the interval itself. So we're going to warm up for about another minute, a couple more minutes here. And as we do, maybe Kosta, you can start to introduce what the balance system is, what parts of our body make up the balance system, and just start to give us a little bit of an introduction.
Yeah, sure. So the balance system is a very unique system. It's made up of a couple components. Our eyes, our balance system, known as our vestibular, which is in our inner ear, and also our joints and skin, which provide feedback of where we are in space. That gets processed. So all 3 of those systems send information into the brain, and then the brain decides of where to relay the information depending on what challenging activity you're doing.
Fascinating. So to summarize, it's not just the system in our ears, we've also got our eyes, we've got, when we touch things with our hands or with our feet, and then we've got that muscular engagement, whether it's our core muscles, our leg muscles, our butt muscles. It's really that composition of so many different systems, eh?
Correct, yeah. All of them working together. Yeah.
So what that means is there's lots of areas that one can improve, but unfortunately, on the flip side, lots of areas where things can go wrong. And I think we're going to get to that a little bit in a little bit of time here. So we're just over 7 minutes. So we're going to start our first interval in about, we'll go in about 30 seconds. So just a reminder, keep that head up nice and high, shoulders back, chest up, core engaged. And then when we're doing that interval, find that balance for yourself by either bringing the knees up higher or increasing the frequency of your steps. Even feel free to try a little bit of both. And remember, if you start to breathe a little bit more, that speaking that sentence becomes a little bit difficult, that's okay. It's just because the exercise has become a little bit harder. So here we go, 2 minutes, nice and fast. We're gonna walk, I'm gonna walk on the spot fast. Maybe later I'll do a run on the spot. But for now, just gonna get the knees a little bit higher, feet going a little bit faster. Here we go. Good work, everyone. So we're coming up on just about a minute into this first interval. I'm not sure if you can hear it, but I am breathing a little bit harder. And I'm going to work on speeding up my steps for the next minute. Good, 40 more seconds. Twenty more seconds, everyone. Good work. Ten seconds. Good work, everyone. Finish strong. And good, that's 2 minutes. So back to that easy walking pace. Good time to say a reminder. have a door open, have a fan on, whatever you need to do to just get a little bit of air circulating through the room so you don't have to sweat too much. So we're gonna do 3 minutes of recovery and Kosta. So going back to that, the balance system and what composes the balance system. So some kind of call balance the sixth sense. Can you speak to that a little bit?
Yeah, so the balance system kind of is designed to give you a kind of clear vision during motion. It detects kind of the speed of movement. And its job is to make tiny micro adjustments as well, depending on how you're challenging your balance system. So most of our senses, like our vision and our smells, we can kind of choose to whether to smell or look at something, but our balance system is constantly on. So that's why it's called the sixth sense, because without us, we don't really realize it's working unless we challenge it. So if I were to jump on a tricycle, single wheel, and try to for the first time, and my balance starts to be off, that's when I feel it engage. Other than that, just day to day, it really just is working behind the scenes without you even knowing. Very much like our heart.
That's, and I mean, I think we could say right now, both of those systems are probably being engaged to a greater extent. The heart's pumping a little bit more blood, and the balance is making sure that I'm not falling over while we walk on the spot here. Now, like, can you speak to, is one system or is one part of the balance system more important than the others, or do they all kind of contribute equally to that overall sensation of balance?
Yeah, so depending what you're doing, those signals, either is from your muscles, your joints, your balance system, your vision system, get processed into the brain, and the brain makes a decision and it says, where do I need to send more information to? Right. If you're in a dark room, obviously there's very little input going into the eyes. It's not gonna be beneficial for you for it to send more signals, kind of reinforcements to the eye vision, because you can't really see. What it will do is send it to the joints and the muscles to make sure you feel where you are.
And I know we're coming up to the end of the recovery interval, so I want to speak to that a little bit more when we start the next recovery interval. Just, I think it was sometime last year, we had a guest speaker come out and speak to us at UBC and talk to the importance of that proprioception. So what you're saying, when you're in a dark room, and that increased sense of touch and trying to feel out where you are, and it's a pretty cool study. So we're gonna get to that after during the next recovery interval. So here we go, interval number 2. I'm gonna run a bit on the spot, 2 minutes. Here we go. For those running on the spot like me, really make sure, engage that core, pump those arms. Need to make sure that my towel doesn't move too much. Keep things safe. Good. So we're about 36 seconds in, everyone. Great work. Another minute and a half to go. Good, about a minute into this second interval. Great work. 1 more minute to go. Keep the arms pumping. Head up nice and high. Shoulders back. Chest up. Engage that core. Great work. Good work, everyone. Last 30 seconds. Good, 10 more seconds. Great work. And down we go. Great. Back to that easy walking pace. Anyway, so that we had some researchers from the States come talk to us, and they were doing studies where they would blindfold people and have them move around in space, and their brain activity was completely different if they were touching, if they had their hand, even just one finger touching something, versus not touching anything. So it really spoke to the importance of that proprioceptive, or that touch feedback, and whether it's the feet or the hands contributing to that balance system. So I think that almost, that speaks to the importance of, as you're getting older, having those external pieces of support to help with your balance. And maybe, Kosta, you can speak a little bit more to how the different parts of the balance system, whether it be the eyes, the muscles, the vestibular system, how do those change with time? Or how do those, as you get older, what happens to them?
Yeah, so what we know from some anatomical studies have shown that the nerve cells in the vestibular system, so in the inner ear, decrease at around the age of 55. Now, the thing that can happen is the blood flow in the inner ear also decreases with age. But again, this all depends on your previous level and obviously past medical history, because so many factors come into play. There are others that argue that it's not so much your balance decreases as your change in lifestyle. You get older, you have more money, you have less time, so you're not going to take transit, you're going to drive. You're not playing sport anymore because you don't have time. You're working more, so you're challenging your balance system less. So because of your change in lifestyle, you're not challenging your balance system as much as what you used to. So there's two schools of thoughts. One, is it actually a physiological thing? I think there's a little bit of that, but it's definitely not a downhill slope at the age of 55. It's a very gradual, much like musculature. The stronger we are at a younger age and into our middle age, the better our outcome is as we are older. So
that's really fascinating. So what you're saying is that, inherently with age, like our muscles, the balance is going to decline ever so slightly, but maybe the less active become, or really what you're speaking to is the importance of lifestyle. So if you are not active and you're not engaged in that system often, then it's going to decline, really decrease much faster.
Yeah. It's like when you're older, you're like, do I really want to go skiing? Potentially, we risk assess all the time, right? We're like, I could challenge my balance system, but I can also, injure myself. Don't want to do that. So it's a risk and reward as we get older, but definitely important to challenge our system comfortably and within our limits.
Yeah, fascinating. So we're actually about 3.5 minutes into this recovery period. So 5 seconds here. We're gonna go up interval number 3, and here we go. I'm gonna run on the spot again. I encourage you to try mixing up the height of your knees if you're walking, the speed at which you're taking your steps. Just get that difficulty level up a little bit. Okay, 15 seconds in. Good work, everyone. Good work. 45 seconds in. We got another minute and 15 seconds to go. Good work, everyone. Kosta, those legs better be turning over fast there, buddy.
High knees, high knees.
40 seconds, good work. Good, 15 more seconds. Don't slow down yet. 4, 3, 2, 1, and good. Okay, so if you got your water there, I'll take a quick water break. No water for you, Kosta. You're not working hard enough. Oh, you got your water.
I definitely forgot my water. Poor form on me.
So, as we get back to walking here, so now we've talked about what parts compose the balance system. We talk about how they change or might not change over time and the importance of being active. What are some common conditions or common things people might experience that indicate that the balance system isn't quite working as well or might indicate something's wrong?
Yeah, so there's a couple of signs. So when it comes to dizziness and vertigo are two interchangeable terms that people think be interchangeable, but they're actually very different. So very common, people will feel this vertigo spinning sensation. So this is very common with a condition called BPPV, benign proximal positional vertigo, which we'll touch, I believe, a little bit after in the next interval. But other things that can have is people's motion sensitivity is very common. I always call it the supermarket effect, where when you go down an aisle and all the shelves are very busy, and if people's visual system is not too well, they'll feel a sense of dizziness. Now,
there's just too much stimulation from all the different things on the shelves.
Correct. Yeah, and that's to do with kind of if your eyes have been affected, and your peripheral vision has been affected as well. Mismatch in the input into your brain, and your brain kind of interprets it in a different way, and you experience dizziness. But vertigo, as just going back to that, is very common. A lot of people, the best way I describe vertigo is to say, if you're lying in your bed, you change position, and the room is spinning, and you almost feel like you have to hang on, that's considered vertigo. Where a sense of feeling off, or very much people describe it as lightheadedness, swaying, or disoriented, that's more dizziness. That can lead us into a different kind of diagnosis or problem.
Right.
And yeah. Go ahead. I thought you were...
Oh, I was just going to say, so just to summarize just for us, a couple of the key indicators of vertigo versus a couple of the key indicators of dizziness.
Yeah, so vertigo is room spinning during a change in position. So lying in your bed is most commonly. Dizziness is kind of that uneasiness, feeling off balance sensation that can come on spontaneously or triggered by something like moving target, busy environment.
Got it. Interesting. And yeah, I think I'm somewhat losing track of time here, everyone. I'm sorry, but I think we're coming up to the end of recovery interval numbers 3. So in about 10 seconds, we're gonna go, we're gonna increase. We're gonna do interval number 4. So 2 minutes, we're going up in 2, 1, and up we go, everyone. So for those walking on the spot, keep that head up, shoulders back, chest up, engage the core, incorporate that arm motion. For those running, really focus on engaging those abdominal core muscles to keep your balance. If at any point you're not feeling quite safe, or if you're feeling a little bit uncomfortable, don't hesitate to put that hand on the wall. If you've got a chair in front of you, hold onto the chair and make sure you're using that touch sensation to really help your balance system. So we're 30 seconds in, a minute and 20 seconds to go here. Good work. Coming up about 50 seconds left. Great work, everyone. I'm gonna try going higher knees for the last 40 seconds here, just to mix it up. Good. 25 seconds left. Great work. Ten more seconds. And down, good. Okay, 3 minutes, and we've got our last 2-minute interval. So Kosta, we were talking about some of the differences between dizziness and vertigo, and then brought up that condition, BPPV. You want to talk to that one a little bit more?
Yeah, so around 80% of people over the age of 65 have experienced dizziness, and BPPV is kind of approximates about 50% of the dizziness in the older population. So what BPPV stands for is benign proximal positional vertigo. Benign meaning it's not permanent. Proximal meaning it's on the outside of your brain structure. So it's in your inner ear. Positional, it comes on with changes in position, and you experience vertigo. So not dizzy, but that room spinning. Now, in our balance system, what it does when we look down, it adjusts, the fluid and crystals adjust to kind of make us feel that we're constantly on a level playing field. Now, most common with falls, head trauma, ear infection, very common. These crystals kind of almost like dislodge from the canals in the inner ear. And what they do, because they're dislodged, when you look down, the balance system tries to adjust, but a crystal stimulates the hairs or the cilia, which sends a signal to the brain, and it makes you feel like you're still moving. So and because of this, you get that vertigo sensation. Now, the good news is that this is very treatable. You basically can reposition the crystals with a maneuver called the Epley maneuver. So most of your healthcare professionals who are experiencing it can reposition them depending on what canal has been affected. And there's a first treatment is an 80% success rate. But there's a lot of factors involved into it as well. So past medical history also plays a role.
Fascinating. And so I think what's interesting, so one of the symptoms of BPPV can be dizziness, but if you're dizzy, it doesn't necessarily mean you have BPPV, right?
Usually, if you have vertigo, so room spinning, then there's a high chance that it's BPPV.
Right.
But then what most people also get, you get treated. Now, because maybe you've had BPPV for quite a while and you haven't really noticed, and you're living in this world of disequilibrium and you're constantly feeling off balance, that's going to cause you a little bit of kind of dizziness even after you have it treated, because now it's like a byproduct where your balance system needs a little bit of time to readjust because it's been so long of just feeling like you're off. It's a terrible condition. You really feel like it's not fun at all.
Well, let's hope I don't get it, especially not during this last interval. So 10 seconds here. We're gonna go up. I know we've gone a little bit over 3 minutes. That's okay. Just make this last 2 minutes a little bit extra hard. So 2, 1, up we go. Last 2-minute interval of the day, and then you're done. Well, you get some recovery, but you're done anything hard until you come back again on Tuesday. Good work. So keep that head up nice and high, those shoulders back, chest up, engaging that torso, and keep the arms pumping. So we're about 30 seconds in, 1.5 minutes to go. Good, coming up on 1 minute. 1 minute in, 60 seconds to go. Good work, everyone.
Next week, you can wear your weighted vest, Josh.
I'm actually picking it up over the weekend, but no promises. I will be wearing a weighted vest. That doesn't sound fun. Or maybe I'll take all the weights out. Vest. Good, 30 more seconds, everyone. We got about 5 more. And down, good. Okay, so we're gonna walk it out. Recovery for about 5 minutes here. Now, Kosta, just before we summarize everything we've learned today, what are some things that we can do to improve our balance system and some of the different parts of it that you talked about earlier?
Yeah, so really just challenging your balance system appropriately is important. So I think in the video I did yesterday, we looked at basically decreasing your base of support. And what you saw is some individuals, or myself, you found a lot of ankle play. So you're almost like your ankles were engaging, your hips were kind of trying to move. That means you're challenging it appropriately. It's very much like when you're lifting a heavy weight. If you're kind of struggling to lift it, that means you're challenging your muscle. So same thing with the balance system. And there's different ways we can do it. Eyes open definitely engages, is purely, you get the balance. But if you do eyes closed, you'll find that your ankles and your proprioception has to work a little bit harder. And then we can do it statically, meaning balancing just on the spot, like a single leg stance, or dynamically. So we're challenging it while moving. So for example, a heel toe walk in a straight line, like a tightrope walk, both eyes open, eyes closed, are great ways to challenge your balance system.
Yeah, so we've got eyes open versus eyes closed. That's kind of allowing whether you're going to have vision, and if you don't have vision, then everything else needs to work harder. You've got your static exercises where, if you're balancing on one foot, that's working on some of the musculature, that's working on that proprioceptive feedback from your joints and your skin. And then further on top of that, you've got dynamic. So when you're stepping, you're then challenging not only the muscles and the proprioceptive at the same time. And then even further, if you were then close your eyes, you're really engaging all different parts of your balance system.
Yeah, and then adding head movements. My favorite balance exercise, I like to call it the gap. What's that?
That was hard. I tried it. It was really hard.
Yeah, it's very difficult. I practice it with patience, that's why. But like doing something like what I call the gallery walk. Every time I walk through a gallery, I'm looking at one painting, just walking, looking at the other, looking at another. So even changing your head position is a great way to challenge your balance system.
Well, and right now what you can do is if you go to the grocery store, you can look at every aisle and try to find yeast or flour. And if you see both on the shelves, then you just keep looking, keep turning your head. There's your challenge. You might not find it, but you've done your gallery walk. So that's really fantastic information. So if we were to summarize everything we've learned today, we talked about the different components of your balance system. So you've got the vestibular system in your ears, you've got your vision or your eyesight, and then you've got that proprioceptive feedback from your skin, from your joints, from your muscles, and all those send feedback to your brain, and then your brain then relays that signal back out to the different parts of your body to really fine-tune your movements. Now, as you get older, there's a little bit of debate with regards to how much those systems really decrease versus to what effect is it just people becoming less active and engaging the system less as they get older. And so if you want to do your best practice, it's really to continue to engage that balance system as much as possible, and that's going to minimize the decline in your balance as you continue to get older. Kosta then talked to us a little bit about dizziness versus vertigo and how those two aren't interchangeable terms, and that how vertigo is that spinning of the room, and the common condition being BPPV is quite treatable with the appropriate healthcare advice and healthcare practitioner. We finished up with some key ways to work on your balance system with eyes open versus eyes closed, static exercises, dynamic exercises, and then finishing up with, when you're doing dynamic exercises, turning your head to just add that extra challenge. And I really encourage you to watch Kosta's video from yesterday that talks more about how to better, or some exercises to better your balance. Now, just to finish up, we're coming up on 5 minutes recovery. Kosta, what would you say are the key takeaways, or if you wanted to tell all your patients something, what would you tell them with regards to balance and the balance system?
Yeah, so some key things is, obviously, when you have, if you experience dizziness or vertigo, consult your healthcare professional, because there's so many factors that are into play that may be contributing to your dizziness. It can be crystals misaligned from your ears. It can be visual, right? In my video, I talked about how figure skaters don't get dizzy when they spin, is because every time they spin, they constantly look at the same spot. So their visual system is very much in tune with their balance system. Now, if there is a mismatch, you will experience dizziness. So appropriate history on what signs and symptoms and type of dizziness you're experiencing can lead the health practitioner to say, is this muscular related proprioception? Is it inner ear, or is it visual? Or is it something else medical that's happening? So a key history is very important. Second thing that is to challenge your balance system kind of daily. Even just walking, head turning, working within your exercise routine. So while you're doing a set, maybe you want to stand on one leg while you're doing your recovery. So fitting it in within your daily lifestyle is probably the easiest way to challenge your balance system. And I'm getting out of breath here. But yeah, what's that?
I said it's recovery.
It's recovery, yeah. And the reason why this is all important is because as it will decrease your risk of falls. And that's going to help a lot with, risk of falling, fracturing, hitting your head, events like that. So very important to maintain a good balance and happy balance system.
And overall, it just maintains that independence as you move forward. So we're coming up on about 7.5 minutes of recovery. I'm going to stop moving. My legs are tired. Kosta's out of breath. Thanks again for joining us today. We learned a ton about the balance system. I hope you did as well, and I look forward to seeing you guys all again on Tuesday. Have a great weekend.
Yeah, thanks very much.